Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. How disruptive mood dysregulation disorder DMDD is diagnosed. Disruptive mood dysregulation disorder, DMDD, is a mental health condition diagnosed in childhood and adolescence that is characterized by ongoing irritability and frequent temper outbursts. /r/n/r/n Many children experience temper tantrums and periods of irritability. However, DMDD goes beyond that and becomes a condition that can greatly impact children's lives. /r/n/r/n Learn more about the symptoms of DMDD, as well as how it's diagnosed and treated. /r/n/r/nVerywell. Zoe Hansenrnrn DMDD is a mental health diagnosis made in childhood and adolescence. It involves persistent anger, irritability, and many severe temper outbursts. While it may initially sound like something that could be a phase, it is much more severe and can cause significant problems for the child at home, at school, and with peers. /r/n/r/n DMDD is a newer diagnosis, first classified in the 5th edition of the Diagnostic and Statistical Manual of Mental Disorders, DSM-5. The DSM-5 contains the formal guidelines used by healthcare professionals to diagnose mental health disorders. /r/n/r/n The diagnosis of DMDD was developed to be more accurate when assessing youth who previously might have been diagnosed with pediatric bipolar disorder. The diagnosis of pediatric bipolar disorder is no longer an option in the DSM. It was found to be overdiagnosed and the criteria inconsistently applied. /r/n/r/n Studies have shown that children with DMDD typically do not go on to have bipolar disorder as adults but have a greater risk of experiencing depression and anxiety. /r/n/r/n Children and adolescents with DMDD display the following symptoms. /r/n/r/n It might be difficult to tell initially if a child's behavior is more than just a developmental phase. However, it is important to speak with a healthcare professional if the behavioral pattern lasts longer than a few weeks, causes distress, or interferes with their ability to function at school, at home, or with peers. /r/n/r/n According to the DSM-5, the following factors are considered when diagnosing DMDD. /r/n/r/n When speaking with the parents and caregivers, the doctor will ask for a thorough history. Parents and caregiver interviews are important to help the healthcare team understand what is happening and how it is affecting the child's life. They might also request information from the child's school and teachers, and they may interview the child. /r/n/r/n The next steps may include a referral to a mental health professional, like a psychiatrist or psychologist, especially those trained in child and adolescent mental health. /r/n/r/n There isn't an established gold standard assessment tool for DMDD, but a psychiatrist may use the Kiddie Schedule for affective disorders and schizophrenia DMDD module, along with gathering information from parents and teachers. /r/n/r/n It is important to meet with a trained mental health provider for an accurate diagnosis because DMDD can occur with other disorders like /r/n/r/n Treatment is always based on the individual child and their needs. Since DMDD is a newer diagnosis, there is little research on specific treatments. /r/n/r/n Most treatment options are based on research about other related conditions associated with irritability, like mood disorders, ADHD, and anxiety. Fortunately, many of these treatments seem to also work for DMDD, but there is still research ongoing to look for DMDD-specific treatments. /r/n/r/n DMDD treatment usually includes psychotherapy, talk therapy, and sometimes medications. Psychotherapy often is started first, with medications being added later, but sometimes they are both started at the same time. /r/n/r/n. There are a few different types of therapy being used for DMDD. Cognitive behavioral therapy, CBT, can help show children and adolescents how to cope with their feelings and emotions. Another method being studied is dialectical behavior therapy for children, DBTC. It could help children regulate their emotions and prevent extreme outbursts. /r/n/r/n. While the child needs to receive therapy, parent training might also help teach the parents or caregivers how to effectively respond to and manage the child's behavior, as well as how to spot potential triggers. It can also teach them the ideas of predictability and consistency, as well as rewarding positive behaviors. /r/n/r/n. There are no medications approved by the Food and Drug Administration, FDA, specifically for DMDD at this time. However, medications are still used for the DMDD symptoms of irritability and aggression, since other diagnoses exhibit these symptoms too and often appear with DMDD. /r/n/r/n. Some medications used in DMDD include /r/n/r/n. All medications have the potential for side effects, so it is important for the parents and caregivers to discuss these with the child's healthcare provider and to monitor and report any observed side effects. /r/n/r/n. Caring for a child can be challenging, especially when they have more specific needs like DMDD. It can cause stress and be overwhelming for both the caregiver and the child. As such, it is important for caregivers to take care of both the child and themselves. /r/n/r/n. Some ways for parents and caregivers to help themselves and the children include the following. /r/n/r/n. If you are having suicidal thoughts, contact the National Suicide Prevention Lifeline at 988 for support and assistance from a trained counselor. If you or a loved one are in immediate danger, call 911. /r/n/r/n. DMDD is a serious illness in children as well as when they become adults. /r/n/r/n. Children with DMDD can experience significant challenges in school, at home, and in social relationships. They are unlikely to outgrow this condition, and the accumulation of difficulties during childhood may perpetuate limited opportunity and compromised well-being as they get older. /r/n/r/n. As adults, DMDD can lead to increased health problems, depression, other mood disorders, and/or anxiety disorders, continued emotional distress, financial strain, and social isolation. /r/n/r/n. Disruptive mood dysregulation disorder is a mental health condition diagnosed in childhood and adolescence that is characterized by severe temper outbursts, irritability, and/or anger that persists for at least 12 months and is not better explained by another disorder or condition. It is usually diagnosed between the ages of 6 and 10 years old. /r/n/r/n. Treatment involves talk therapy with a trained professional and may include medications that are used to treat mental health conditions, such as mood disorders, ADHD, and anxiety. /r/n/r/n. It is important to take care of your child and also to take care of yourself. Speaking with your child's pediatrician or a mental health professional who has experience working with children and adolescents will help get your child the right treatment and direct you to other resources and support solutions. /r/n/r/n, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.